All right, everybody, welcome back to the Adventure RX podcast, brought to you by your host, Nick Anderson with Pinpoint Physical Therapy. Our guest today, Mr. Matt Stevens, one of my buddies in Cleveland, sports and orthopedic physical therapist, now owner of Forza Therapeutics out in Ohio City. Matt has been a friend and I guess I could say mentor of mine, like to pick his brain. Been in the private practice realm for probably about a decade or so, right, Matt?
Yeah, this would be
So it's
year.
been a great resource for me. Yeah. How are you, Matt? Thanks for coming on.
Yeah, I'm great. Thanks for having me. It's always cool to kind of do these collaborative projects with other PTs in the area. So I'm glad to see you're out getting after it.
Yeah, it's been a fun podcast. Making these connections and conversations is always fun, especially locally. I think in Cleveland where we're all pretty tight knit community. Especially in the private practice PT realm. I think we all know each other, at least know of each other. So yeah, hopefully we have a good conversation today. Looking forward
Yeah,
to it.
me too.
So tell me more about Forza, where you're at, what are your goals with it. I know we talked over little about a year ago when you're kind of getting things started. Tell me more about like what that process has looked like, starting that business up.
Yeah, it's been about a year that we've kind of been operating under the Forza name. I had a previous private practice for about 9+ years and sold that and kind of went full cash base at this point. It was an interesting opportunity that kind of popped up, for us to take over a small gym, and build out an adjacent clinic to kind of still, create this kind of sports orthopedic, therapeutic type practice. So we've kind of started to integrate some different services from massage to some nutrition as well as PT and personal training. So just really trying to kind of blend all of those things together to kind of create a cohesive experience for our patients, clients. And yeah, it was a bit nerve wracking to kind of take the leap
Yeah, I
into
love
the
that.
yeah, it was nerve wracking for a little while to kind of make the leap into the cash based world. I was an insurance based clinic for so long, but it's been nothing but a great transition so far.
What are the what are you seeing as the benefits of mostly cash pay or self pay, out of network, whatever you want to call it, versus being in network?
I mean, obviously, just the headache of dealing with reimbursement and that kind of side of things. Always kind of fighting for your patients, clients, as well as yourself to get paid for your services. I think also being on the cash based side of things, it brings in a lot of just self motivated patients or clients that really want to get better. So it's a great community to work with because they're investing in their own health. They've got big goals, things they want to achieve, and it's kind of fun to be a part of that, their journey and help them kind of meet whatever those goals might be. But it's an interesting, we're not really motivating people to get off the couch, in this kind of setting. I think a lot of it's more reining people in or, getting them on proper training, rehab programs to kind of help them achieve their goals versus, motivating people to get off the couch to do their, corrective exercises, rehab, whatever it might be. So I think that's a nice big shift, even though my sports ortho
Right.
clinic before was still pretty active folks.
Yeah, I think that's a good point with, if someone is seeking out, going out of network, they're probably to a point where maybe they've tried other things or other settings, and they're just looking for whether it be maybe more expertise or more time with the doctorate of PT, and they're paying a little bit more per session generally. So like you said, they're actually bought into really getting back to whatever it is they like to do, whether that be, I work with a lot of runners, weight training, whatever that might be.
Yeah, I think it's we're seeing
You know,
this kind of period of time where I think people are much more active at a much higher level later in the lifespan, which is kind of a unique time. And I think people are really investing in, a lot of that. And I think we've just become a pretty integral part of that, for them, which has been nice. Um, to kind of be able to still work in the system, still be able to help people, motivate people, but kind of be, out on our own, doing our own thing and kind of creating a more one-on-one experience. I think a lot of folks do get frustrated in the big system. They, might see multiple therapists, treatment gets all over the place. Here we can kind of really hone in one-on-one, develop individualized programs, and just kind of give them more of that, personalized feel that they might not get other places. And I think it's no fault of some of the therapists in those systems. It's just a matter of the system itself that they kind of get stuck in. So I feel fortunate that we're able to do this, and I've been doing this for a while. And it's awesome to see, other folks in the area do the same thing, because I think there's a lot of people seeking our service that are frustrated with the system. And, I think we can kind of fill that gap for them.
Yeah. Yeah. I think having more of us in the area, I always say there's plenty of pie, there's plenty of patients out there that need help. Whether that be from me, from you, from, I know a few chiropractors as well that are doing a similar setup. And yeah, I think the more the merrier, and everyone has their own little flavor of doing things. And some, a certain patient might vibe better with this person or that person. I've referred patients out to others. And doing the private practice, I think that's one of the benefits of physical therapists being at that doctorate level. We've been, I don't know, it's been probably 15, 20 years, I think, for the doctorate for schooling. And there's a lot of pros, a lot of cons. It's a lot of time and money to invest. And I think that, I lost you, Matt. Hold on. Got you back.
Sorry.
Cool. You're good.
Might have better service here.
Yeah, that looks smoother.
Okay.
All right, we're back. I'll
Little,
edit that. It's fine.
It's when it gets rainy here, the clouds kind of create a lag in my one internet. But anyways,
It's all good. I don't know how much you heard me there, but I think I was getting into, so the doctorate level of PT, so the DPT, I know it's a hot topic. It's a lot of time, a lot of money, to invest in a career that, we're probably not going to get rich doing this, right? We're doing this because we like to help people, like to care for people. But I think one of the main benefits of being at the doctorate level is being seen as more of a primary care clinician, sort of like, what we're doing with Ohio has direct access. Of course, we, have to communicate with physicians when needed. But I love to see physical therapy moving toward that direction. I don't, at the doctorate level, we do have the base of knowledge to at least know when to refer out for red flags, yellow flags. But what are your thoughts on the whole DPT? I know it's like, I go on Reddit and it's just like a crap show of arguments.
I think,
But
I think you could argue it either way, really. I think for us, doing what we do now, I don't think from a legal standpoint we would have gotten to where we are having direct access in a lot of these states without this clinical doctorate degree. Obviously, we get a lot of other traditional medicine kind of built into that, which is needed to, identify these certain things. And there's been times where, I just had a recent case where I had a guy that had ankylosing spondylitis. None of his other physicians actually picked up on this for years. He thought he had postural pain. I was the one to create this formal diagnosis, get this guy to where he actually needed to be to get care
gotcha.
to get better. I've diagnosed in a more hospital-based outpatient setting, aortic aneurysm, right? Something related to those are things that I think that could have been missed. And granted, that's 2 out of how many patients I've seen over 15 years, but those 2 people got the care they needed, I think, because of that additional education. And I think we have practices, that allow us to treat and practice the way that we want to because of the movement towards that clinical doctorate degree. Yes, is it a big expense? Is there a lot of things that maybe we don't use on a day-to-day basis doing what we do now? But I think to get the profession to where it is, I think there's other things, right? Having that degree, I wish we could get right? If we could write scripts for diagnostics and things like that, that would be fantastic. I think those things might be down the pipeline. We've put all this effort in now. Hopefully that will kind of come down the line for us at some point. Some days I don't know if I want that
Right.
responsibility to do that or not, but I think, there is some level of autonomy that we have that we didn't have prior to, right? And I think I think my frustration initially was not a lot of people knew what direct access was or seeking this out 10 or
Right.
so years ago when I was really kind of getting into this. But now I think we have become more of this primary point into the medical system for musculoskeletal orthopedic, conditions. And I think as the more you kind of build reputations, and people know that we're doing what we're doing, obviously being small business, we don't have these big, massive marketing budgets to get the word out there.
Right.
Um, and so I think it's something that was needed. Yeah, there's a lot of debate on good, bad, and different. You're going to spend an extra year in school, an extra 30, 40 grand, but, it's allowed me to have a lifestyle that I enjoy. Now, is it right for every PT, or do they have the same advantages maybe you and I have, or kind of reap the benefits? Maybe not. So I think it depends on probably what setting you're in and how much you appreciate the doctoral degree. And that might vary, right, from clinician to clinician, and, kind of what setting you're in. And I think some that still work in a hospital-based facility and their care is dictated by physicians, I would see the frustration of going to a clinical doctorate degree because they haven't developed the autonomy that you and I have to kind of be this primary point into the system. So I think that's kind of my take on it. Yeah, I mean, would I like to have an extra, year back on my life and an extra 40 grand in my pocket? Of course, but I think the flexibility in the lifestyle and my ability to practice the way that I want to now is well worth that, during that time.
Yeah, for sure. I think that, you look at the chiropractic school of education and their model being very private practice based, and I know some are going out of network as well. I think there, pros and cons of chiropractors. I'm friends with some very good, sports chiropractors. I think they're ahead of the game as far as PT, being seen more of a direct access, private practice, cash base. So like we're definitely trending in that direction. I think more and more patients are getting to realize that there is direct access in Ohio. Like, what does that even mean? And then I still get patients, quite often like, oh, you're at the, the doctorate level, and even that isn't well known, I think, just in the general population.
Yeah, it was interesting. My previous practice, we did a lot of Google SEO marketing, and the amount of people that would come to us just because they saw, us on Google and they saw that I was a doctor, I had a
Yeah.
doctor of physical therapist
Mhm.
that chose our clinic over somewhere that wasn't marketing that or
Right.
advertising or labeling themselves. Because there was at that early time, because I was probably the first class uh, at my university to go through the full DPT program. So
Okay.
we're kind of right at the brink of that
Gotcha.
transition. And there was this kind of labeling yourself as a doctor or having people call you, a doctor in certain settings, depending on where you were. There was a lot of interesting debate on, if I had a seasoned clinician that had been practicing for 10 to 15 to 20 years that had a
Right.
master's degree and then walking in and saying, I'm Dr. Matt Stevens. And I was kind of very self-conscious about that because we're physical therapists, but, we have put in the work. I think letting people understand that it's a clinical doctorate, just like a doctor of medicine. We are just a doctor of physical therapy in our specialty, and kind of letting them understand kind of what the differences may or may not be. Um, but I will say that once people saw that, they definitely kind of had this more just, I think, respect or kind of buy-in to kind of what we were selling them because of that level of education. So I think there is some merit to just putting the title there, that people, obviously know that we put more time and more effort into kind of being, a skilled clinician in our field. And so I think the more it's kind of come out, the more it's become more normal, or at least normalized, at least for me to kind of refer to myself as that, put it on my business card, on the website, and those kind of things. So it was an interesting transition for us because we were in this time period where we were new grads, we were doctorates, and we were probably the only ones, right? Everyone that we were doing clinical rotations with, all of our our advisors or our, PTs that we were kind of working under, were all masters and or less degrees. So it was like an interesting transition period where I think now the majority, some have done transitional doctorates, but we're kind of at this place now where it's kind of become more of the norm.
Yeah. I've always been on the side of, we earn this degree. Let's go, by doctor.
Yeah.
And in the hospital setting too, it can be overwhelming, and and awkward for the patient's sake if you're introducing yourself as, doctor this, doctor that, and then, they're meeting with cardiology, meeting with the primary care. It gets a little tricky, and I think in the hospital setting. Yeah, any DPTs that are listening out there, man. I mean, you guys earned this. You got the skill set. You passed the boards. It's not easy. You put the time and sweat equity in. Go by doctor, man. You earned it. We're at that level now.
Yeah, it just, I think with the timing for me, it took a while to get there.
Right. Yeah. Yeah. Yeah.
But yeah, it's a good place to be. It's a good feeling to have. It's a nice thing to have on your, on your business card, on your wall, hanging in your office. So
Yeah. Yeah. It's a little good for the ego too, right?
yeah.
Are you currently training for anything right now? I know you mentioned doing some
Yeah,
mountain hiking.
it's an interesting year. I turned 40 this year, so I have some buddies they're planning a trip to go run the Wonderland Trail.
Okay.
My sports background is like traditional sports. I played college football, never really got into the endurance world until like much after that. So turning 40, and this is kind of my year of ultras. So I just finished a 50K last year. I got a
Wow.
50
Nice.
in 3 weeks, and then we're gonna do the Wonderland Trail. So it's been a unique blend of looking at my own training at 40 with two young kids, and like what does that look like? Like what am I training
Yeah.
for at this point? So and it kind of ebbs and flows from heavy lifting to endurance work, and I'm trying to kind of blend those two together, which has been kind of a fun, just like self experiment of, how do I blend my strength training into like fitting in high mileage in a short amount of days with two little kids running around and sleep and running a business. But yeah, so we're going out to run. It's a big 3 day, like 90 plus mile, excursion to run around Mount Rainier. We'll do about 30,000 feet of elevation. But it's kind of what I got on my bucket list this year. I feel like generally most years like I just have like one big goal, one big kind of trip or something that I'm training for. So that's this year's goal, turning 40, spend 3 days out in the woods in the mountains just running.
Yeah, that sounds challenging. Like having that goal set, I think, is so important for people. I'll have patients ask and say, hey, just sign up for a 5K in 3 months, and there you go. Like
Yeah.
you paid $50 to do it. You got to do it. You got to train. Uh, Especially as we get busier and older, like you're saying, you're balancing being a father, being a business owner, being a significant other, and it's a lot to throw in the training. So having that little extra bit of motivation, because I think some patients see physical therapists as like the God's given of we're motivated and we're always doing the right stuff, and that's I think that's far from the truth. We're still people. You yourself, are you a good patient to yourself as far as like recovery and some of this hard training you're doing, or you just kind of grind through it and deal with it later?
Yeah, it's right. I feel like this year is more the mental challenge of doing all this. I feel like, and you're probably the same way. You put tons of effort into all your patients, tons of energy, to get
Right.
them better, to help them to your goals, and sometimes you kind of put that on the back burner for yourself. But I'm generally more of an introvert kind of person, so my me time is kind of running alone in my own head, just kind of, getting that kind of clear mindset. I do a lot of things that I probably would never tell my patients to do. Like I started this training program and I was like, let's just see what 10 miles feels like today. Like
Yeah, yeah,
see
yeah,
where I'm at. Like would I ever tell anyone to go just start going from like literally 15 miles a week to bump to like almost 30? Probably
yeah.
not. I've
Right.
I've somehow been relatively lucky on the just overuse injury side of things. I've been able to kind of avoid some of that over, most of my sports athletic adventure thing. So I just kind of wing it sometimes. I do really, at this point, being at the age that I'm at, really honing in my nutrition and really honing in my sleep as best I can. Those are probably the two biggest variables that I do really try to manage, as far as from a fueling sleep standpoint. Um, and I'm just a firm believer that, like if I'm asking my patient to do something, I should be able to do it or demonstrate it. And I feel like I try to just keep, whether it's, my movement patterns or, flexibility or strength, I do in that realm, I think really practice what I preach. And I think probably for you as well, patients have good buy-in because you can speak their lingo, you do what they do, you train like they train. You're not one to probably tell someone to, hey, you got knee pain, let's not run anymore, it's not good for you, right? And I think that's where I think a lot of folks, really buy into what I'm trying to teach or preach to them, because I'm living the same lifestyle that they are. Still have big goals. I still have things I want to do. I still train those ways. So I feel like from the recovery side of things, I might lack just with two kids and life. Like, yeah, I mean, there was a little one in my bed at 5:30 this morning, waking me up and like ready to rip and roar today. So did I get my 8 hours? No. But you do the best you can, and I think for me on the nutrition, hydration, sleep, those are kind of what I prioritize. Do I do as much body work and that kind of stuff? I mean, probably not. I do generally, have my yoga mat by the TV or something. So if I got time, I'm gonna sit down and stretch. I think the kids keep me young in that sense because we pretty much live on the ground, wrestling
Yeah,
matches,
yeah,
and I kind of get
rolling
my
around.
functional mobility that way to some degree. But yeah, I mean, I think knowing what we know, it's easy to kind of just, oh yeah, it'll be fine. I'll get to that later. And you're kind of, whether you're writing programs for someone else or this or that, think about doing it all for yourself. Sometimes it gets exhausting, but um, I think mostly, we're probably in the same boat that we kind of practice what we preach to some degree with our training and our focus on some of that. Maybe not to the level that I prescribe to people or do some things that I wouldn't always tell people, but that's kind of what our patients do sometimes too, right? We're all human. We got limited amounts of time to kind of fit it all in, and so I'm not a professional by any means. So you're trying to squeeze these workouts in. Sometimes at 4:30 in the morning, I'm up to get a long run in before the kids get out of bed and get life rolling. So
Yeah, for sure. I think, living or practicing what you preach, like you said, I've had some patients come in that are into sports that I have limited knowledge in, and I'll go out and try them. Like one of them was a few years ago, I had someone in for hand issues. They were a climber, rock climbing, and I had very minimal experience with climbing. So I went out and tried it, and it was a lot of fun, and I want to do more. But yeah, just knowing the lingo too, the buy-in of whatever sport it may be. Like for you, you played football, so like the ball sports, like we know the lingo and how to communicate with those. The distance running, powerlifting, CrossFit. Um, I'm in a kayaking club, so just knowing kayaking, canoeing lingo, whitewater terminology, all that good stuff. But yeah, like for me, I actually ended up I saw you about a month ago. I need to come back in, by the way, do some testing. But I came to see you because like I know that you're in the realm of things I like to do, and you're doing the things I like to do, the lifting, the running, the sports, um, and that's who you want to go see, right? Like
yeah.
you want to see someone, and maybe they're not currently participating in that sport currently, but someone that understands the mechanics of it, and at least if they're not at least currently, participating in whatever the activity is that you like to do.
Yeah, I mean, I think that's how I got into doing some of this stuff that I wasn't, post college, post graduate school. I kind of started in the sports ortho world. I got to try out, I mean, CrossFit for probably 5 or 6 years, at least at a minimum, pretty intense. And then I mean, I lived in the weight room for so many years. So I kind of found some endurance sports, started, treating triathletes and, kind of ultra runners, and did the triathlon thing for 4 or 5 years, did some cycling for a handful of years. It's kind of more just people come in, they have cool goals, they like to talk
Yeah.
about them. That sounds interesting. Like,
Right.
let me give it a go. But I think, if someone comes in and they want to, they're they have a back injury or shoulder injury from, snatching. Like I can talk about, baseline snatch mechanics. I can build out progressive programs for that because I've done that. I've lived that. I've understood that. Same thing on the, the ultra running side of things. It's like, okay, so I can kind of bridge that gap. I'm not an expert at any of those, but again, I know what all those movements are. I know the mechanics. I know the, how to kind of rehab or build programs to help people get to where they need to be, or at least what physical demands that they're going to put on their bodies and what do we need to prep and prepare for. And I think that's just what's been fun about experiencing, or being in the private practice setting and, treating a lot of these unique folks that have big audacious goals. It's like, oh, that sounds kind of fun.
Yeah.
I have a
Yeah.
guy right now. I did his ACL repair. He's a kind of, skier. Last year, he's just doing some personal training with me now, and he's convincing me to go out and do like a mountaineering trip next year. So we're starting to put that together to
Nice.
climb some
Yeah.
high peaks, some basic rope skills, and it's like it kind of just you talk about it enough with somebody, you spend this hour one on one with somebody that
Right.
amount
Right.
of time, and starts to kind of just light a little fire in you to kind of try some new things. So I think that's the beauty of what we do and the people that we work with, and there's a lot of just inspirational people out there doing things in their 60s, 70s, 80s, even,
Oh
nowadays
yeah.
that are
Yeah.
like, it's like you kind of aspire to kind of still be, active at that level, and you know what it's going to take. And I think we have a slight upper hand where we kind of know what those, how to optimize our health and, wellness and take care of ourselves to some degree. We're not always maybe the best at it, but, trying to line myself up to get there and do those things like some of my patients and clients are doing.
Right. Yeah. It drives me nuts when I'll have someone come in that, let's say they're an ultra runner or they're a distance runner, and the answer they were given previously from another opinion was, oh, you got to stop running. Well, first of all, they're not going to, because
Exactly.
because runners like to run, right?
Yeah.
That's identity too, right? Like, I'm a runner, I'm a kayaker, a soccer player. Like that's my identity. I'm not going to stop doing it. I don't care what you say. Like you're
Yeah.
crazy telling me to stop. So I think a lot of it is just, literally just listening. And a lot of my job is listening and just giving permission to keep moving. And whether we modify or we tweak the programming, tweak technique, deload week, whatever it needs to be. I think a lot of it, like low back pain, especially, is so common in this country. Neck pain. It's almost giving patients the confidence and I want to say like permission to keep moving, and developing that program is so huge.
Yeah, I think we kind of there's this like fear-based system of I move and my back is going to break, or these things, and I tell people, a lot of folks they still have goals, they want to do the things they love to do. And I mean, yeah, is running 100-mile race the best thing for you, right? Probably not in the grand scheme, but you're not going to tell somebody like amount of tissue breakdown, stress on the heart, like all this stuff, right?
Right,
But
right.
they're not going to stop doing it. And if we can do this if I can help you achieve this goal in the safest manner that's going to be best for you, and we know that we're going to have this giant stress on the system that we're going to have to recover from, how do we build an appropriate base to get there? There's ways to do it. Now, hey, I mean, there's going to be overuse injuries, and I tell a lot of my folks injuries are normal. Like that's sometimes part of the process. Like you're trying to find the limit of how far you can push yourself, and at some point an injury might be there, and it's not something to be scared of or something to be that's going to shut you down forever. But we cross that bridge when we get there. We don't want to get there, but that's sometimes just part of the journey. And it's not like things are broken or things are going to never be fixed, or that kind of stuff. But I think people have goals, and I mean, even running a marathon is probably a lot of stress on the system. Like
Sure,
creates
sure.
a lot of tissue breakdown. But if that's your goal and that's what we're going to work towards, then there's ways to do. And I think as people age or their body changes, programs change. And I think being able to speak that lingo, and you've done a lot of different kinds of things throughout my training, and it's maybe someone in their 30s or 40s could run 6 days a week and with minimal cross training and minimal, but maybe when they're 50 and 60, they just can't handle that. So can we get away with 3 to 4 days of this and cross training and doing other, ways to stimulate, whether it's metabolic stress or whether it's cardiovascular or whether it's strength training, how do we blend all that together to still get to the same outcome? I think the process might change or the training might change. And that's sometimes hard to get people to wrap their head around too. It's like, if this is our goal, how are we going to get there? And it might look different than what it used to. But our goal is to still help you, whether it's identify as a runner because I want to train for this marathon, but that training program might look a lot different, and that's okay. And I think helping people through that, and having some of that, experience in different realms helps get those folks to meet their goal that they're trying to get to.
Yeah, I think you had a really good point with injury. I mean, I like to describe it as, it's part of living and it's part of being an aging athlete. As we continue to want to stay active doing the things we love to do, things happen. And especially if you're really pushing, on that higher level, whatever activity it might be. And it's not injury prevention, right? That's impossible, but it's injury risk reduction. And I think that's a very important differentiation where, like you're saying, you can optimize sleep, nutrition, your programming, stress management, hydration, correct progressive overload, deload weeks, and use all of that to then be smart with training and just reducing that risk for injury. Now, you can still optimize everything perfectly and stuff still might happen, right?
Yeah.
We're human, like, an IT band syndrome or a tendonitis might flare up. Like, we're human, it happens. Controlling the variables that you can, I think is so important, and just getting that getting that verbiage correct, I think it just shifts perspective a little bit, especially when someone might be frustrated with an injury that maybe they haven't had before.
Yeah, I mean it's right. The fastest way to get worse at your sport is to get injured, unfortunately, right? And you're
Right.
trying to kind of, we talk about risk versus reward a lot in I just had a guy, he's got a race coming up in 2 weeks and he's doing high rocks and he's got this Achilles tendonitis that's flared up and we had some discussions on obviously, what's the risk of trying to do workouts and speed workouts the next 2 weeks and the amount of fitness you're going to gain in 2 weeks is not really going to make a difference, right? Like we
Right.
can train that high intensity in other capacities. We can do probably very low aerobic, low output running just to kind of from like some muscle fatigue standpoint, right? But what's the risk versus reward of doing these certain things based on the goal and based on the timeline? And I'm sure you probably get a lot of this too. It's always that last 3 to 4 weeks of training when the volume gets super high that the injuries start to kind of creep in and people walk into my office like, I got a race in 3 weeks, fix me. Like, and this is, I know we had talked about maybe discussing some PT myths, but for me, like I don't do magic tricks. I tell people, right? Like
Right.
my hands don't magically heal
Yeah.
people. I mean,
Yeah. Yeah.
there's
Yeah.
things that we can do to facilitate some pain, to facilitate, potentially healing and optimize, but there is a timeline for our body to heal itself to some degree too. There's ways to train around this to get to the starting line, and that might look different, depending on the
Right.
injury, where they're at in that process. A lot of times, 3, 4 weeks out, I'm like, we'll put a band-aid on it till we can get there, but like there's not some magic
No.
hand technique that we can do. And I think that's one thing that I've gotten better as a clinician over the years is just ability to educate people. I think when you come out of school, or at least for me, it was like I wanted to make everyone feel better, visit one, and they're back to like it just doesn't work that way. And I think over the years, most of what my practice is education, right? There's things that we do in office, whether it's needling, hands-on work, joint mobilization, manipulation. I think a lot of it boils down to assessment. Where are we loading? Where are we putting extra stress on the body? Different things like that that's causing these overuse injuries, potentially working on some imbalances. But a lot of it's teaching them how to deload appropriately, reduce stress on the system, address any kind of correctives, and then progressive loading to get them back to where they want to be. And I mean, that's probably the gist of my practice, right? Is
Yeah.
more
Yeah.
on the educational side of things than it is actually. I mean, I do a lot of hands-on work and I do a lot of stuff to promote tissue healing, but that's half of it, right? You get right back to training, you're going to end up back in square one. So I think it's the combination of, both of those facets of program design that I think is one thing with the doctoral level education that we get is very much lacking on the strength and conditioning side of things, or at least when I went to school, it was not really focused. It's still oh, we have a weakness here. These are some TheraBand and light dumbbell exercises, but your client wants to run 100, miles, or they want to get back to back squatting over 300 pounds or snatching a certain, whatever, whether it's CrossFit lifting. And there's a huge gap there, I think, that's missed in what we do in the sports ortho world and our education. I know a lot of it, kind of falls on us to kind of, learn on our own. Um, but I think that's why people come to me, right? For the most part, is like, I want to get back to doing this thing. I've tried PT that got me to here, right? But yet
Right.
I can't bridge that gap between like, how am I still going to go do 100 pull-ups in the CrossFit gym and, back squat 400 pounds or deadlift, whatever. And how do they get there? And I think they keep injuring themselves in that transition of like acute injury, which is easy to kind of manage or get over to some degree. Your body's good at doing that. But then how do I address whatever imbalance or whatever movement pattern issue or tissue dysfunction or just movement pattern dysfunction that then is causing me to get re-injured all the time when I start building load or kind of progressing past a certain point. And I think that's where I think people come to you or people come to me, is to bridge that gap between, okay, I rested, I did some really easy PT stuff, and now I'm still getting injured. What do I do? And I think that's like my wheelhouse, or probably yours too, of like the clients that we're seeing in the office.
Yeah, I think traditional, like, I think what most people think is traditional PT, if we look at the old crappy model of like a little massage, a little ultrasound, get the yellow TheraBand out, do some rotations. I mean, essentially that's just rest, right? I mean,
Yeah.
it's glorified rest. Your tissues heal, tissues have healing time. Um, you know, different tissues heal more quickly, some don't. And so, if you just rest, the body will eventually get better, right?
Yeah.
And
What was that
I
old
think,
study? It's like 80% of all back pain will
yeah,
just heal on its own.
yeah, it'll get better on its own. And I think what you're saying with like our manual techniques, like our hands, the dry needling, the scraping, whatever, can certainly help facilitate and speed up some of that acute healing or subacute stuff. Um, but what I think is the doctorate level, like we're coaches, man. Like we're teaching these people how to heal themselves. We're creating this program that they can then take. Because I don't know about you, like I don't see patients more than once a week. And if rarely will I see them more than once a week. And I don't want them relying on my passive modality, dry needling, whatever it may be. I'm trying to teach it like, can that stuff help reduce pain, tweak the nervous system, kickstart some blood flow, some healing? Like, absolutely, sure. Um, Create exercise, maybe a little more comfortable, especially if they're flared up. But then it's that education, like you're saying, that coaching component. That's like, hey, I'm here for you. This is what I think you need to do, and then getting the buy-in too with that end goal is huge.
I mean, yeah, I'm pretty much the same way. Most of my clients are one time a week, maybe. And then, most of mine, I'm writing some sort of custom rehab program week in and week out that's
Right.
progressive loading and building. Because I think that's where giving someone 3 sets of 10 of a TheraBand clamshell or whatever they're doing is like, you going out for a 2 mile run is going to be more load on that hip than doing like, right? Like that's
To do
already
100
surpassed.
clamshells, yeah.
Yeah, it's interesting that there's still that level of PT out there with the amount of knowledge that we have and the amount of just, resources that we have, that like the educational side hasn't quite caught up to that. Especially because like I think the most of what we do is in the sports and orthopedic world, right? Like as far as, there is inpatient PT and things like that, and that's kind of its own subset of, things that I've learned and forgotten, just kind of disappeared. But I look back at my Therax education and it was like minimal, right? And
Was
it's
wasn't great, yeah.
yeah,
I think now I'm not, I don't have my CSCS, but I have the material, the books. I had a lot of it in undergrad. I think a lot of undergrad programs aren't created equally. I don't know what your undergrad was. Mine was an exercise science program, one of the better ones in the country at University Buffalo. And we got a lot of the SCS type of education, or the CSCS, sorry, education, with programming, with knowing the lifts, with progressive overload, energy systems, performance testing, right? Like sports specific performance testing. Like you're
yeah,
not going to give a distance runner the same return to running test as maybe like a basketball player potentially, right? There's
yeah.
some baseline tests, but that might look a little bit differently based on energy systems they're using and movement patterns. So
Which
um,
which is interesting that like you said, I have where I was at Baldwin Wallace here in the Cleveland area, and I had a pre-physical therapy, exercise science kind of double major, and it's I don't want to say sad, but we got more of that exercise phys, exercise science education in my
Right.
undergrad than we even brushed in
Yeah.
in
Same.
PT school.
Same.
And I know that's like a specialty degree, but that's so much of what we're prescribing, as far as what a PT can prescribe, right, is going
Sure.
to be exercise and movement.
Yeah. Yeah. Yeah.
And the fact that that's not a giant component of what we normally do is, or what we learn in PT school, I think is just a frustration that I've always had. I've talked to folks at my university, where I got my PT degree, about doing like a specialty subset, like, special topics kind of course on that, and just kind of got little traction, with developing something like that for them, because I think it's just such a needed space, in our field that's just not there. And I don't know. I mean, I guess I've been out of the educational side of things for 15 years now, so I don't really know what some of those programs look like. And like you said, all programs aren't, created equal. So I think maybe
Right.
some might do a better job and some might not. I know a lot of the kids that come out of some of those like Ohio State programs where they have big, facilities on site. I think they sometimes do a better job, but it's also somewhat on the actual student themselves to seek out clinical rotations or, clinical experiences that really kind of hone in on that. I think some of us are just lucky to get placed in those spots or get the spaces that we want or the rotations that we apply for, and some just aren't. And I think that kind of really kind of differentiates some folks. But nowadays you have so many resources out there, to kind of continue that learning process on your own. And I feel like even when I go to sign up for continuing education courses, there's not even a lot of like true strength and conditioning courses out there that are that good. Maybe that's something that me and you need to develop, right?
Yeah. Well, hey, I'm down. We could come up with that. Make some money.
Make some extra cash on the side,
Yeah, for sure.
teaching. But I
Yeah.
feel like it's still a huge gap in our profession. But I think it's also what makes us unique and why people come to us, because we do speak that lingo. We have put time into to educating ourselves on that, and just we have clinics that are designed to allow us to do that for folks, right? We're not double booked. We're not seeing, 30 patients a day.
Right.
We're able to kind of hone in on that a little bit and really kind of provide that unique care that I think people are seeking nowadays, because I think they have equal frustration in the system as we do, and why we got out, and why they're willing to pay a premium for that. But we're also not selling them on, you need to come in 3 times a week for 6 weeks to get better. Like, hey, we're going to make this investment. Most of my clients, maybe I'm seeing 4 to 6 times max over the course of 2 months. And I think a lot of times, right, you and I probably work ourselves out of a job. Like, my goal is not to see you back in my office, right? That means
Yeah.
I
Yeah.
did
Yeah.
I did well, but that means I need to fill that spot again in 4 weeks. But I think that's
Sure.
what what makes people talk about us and refer other people, and kind of they have another recurring injury, they're going to come back in, and it kind of keeps you going that way.
Right. Yeah. It's a outcome based profession, right? At least
Yeah.
it should be. And a lot of the time, it's maybe not valued as much by some payers and some insurances, but um, yeah, I hope if anyone's listening, if you've had bad experiences with physical therapy, in various settings, interview a PT next time you go in. If you're dealing with, let's say, post-op ACL, or maybe it's an Achilles tendonitis, tendinopathy from running, call around and, ask, hey, do you work with distance runners with these issues? How many a year? I love when people call me and ask me that, because I'll say, I'm not a huge CrossFit guy. I don't do a lot of overhead pressing myself. Maybe go see someone like Matt, or that's just one example, but I've certainly have referred out before, and I think patients doing that due diligence, that they might not even know that they can do, right? Like, I think at this point, and it's not the physical therapist themselves, but the where you go is not created equally. You can certainly have more specific care for you, depending on where you end up, and where you end up may ultimately decide like how well you do with the rehab and reaching your goals as well.
Yeah, and I think I've had folks that we don't speak the same lingo that come in, and it just doesn't, and it's not, and that's okay too. I mean, I have a certain approach, and I'm sure you do too, and I feel like we're kind of probably very similar in the way we practice, but it's not always for some people. But I feel like a lot of it too is for some folks is kind of rewriting the way they're wired and the way they think about injuries too,
Sure.
because I think they've been conditioned to think just because something feels tight, I always have to stretch it or I have to foam, or like there's different reasons why things present tight or sore or whatever, and it's kind of really diving into why that is. And for some folks, they've been conditioned that I have this back injury or this disc herniation or whatever it might be, and I can never do X again, or never do this certain thing. And I think some people, it's kind of they've been conditioned to believe that their condition limits them in certain ways, or they can't do certain things, or if I do this it's always going to hurt. And sometimes rewriting these kind of more chronic pain, chronic injuries from a neural pathway is interesting too. I think that's a whole other discussion to get
Yeah,
into.
we could talk for hours on that side of things. Yeah.
I think it just goes back to kind of what you and I do from a patient education side of things is just, we have a little bit different, or at least most times, a slightly different narrative than what they've heard before. And sometimes that resonates with people and sometimes it doesn't, and that's okay too.
Yeah. Yeah. We're gonna wrap it up, Matt. But one more question for you. I like to ask this question at this point. So you're 39, turning 40, doing this huge event at the end of the year. Father, business owner. What do you define as success right now in this point?
Oh man. Success at this point right now is, I don't know. I mean, I feel like a lot of my success right now is just seeing my kids thrive, right? So whatever I got to do to, stay healthy for them, my family, my partnership with my wife, and like I think that's really success is just having. I don't believe there's any balance doesn't really exist, right? I think it kind of shifts and ebbs and flows. But I think right now his success is having flexibility and time to kind of spend and be present with my family is probably my biggest level of success at this point right now. And I think I've created a work environment that allows me to do that, a level of health and wellness that's allowed me to kind of do that as well, and kind of created this this business practice that's allowed me to kind of have that. So I think that's probably my level of success right now is just having the time and the ability to kind of shift focus to really focus on the things that matter and still have a business on the backside that's, making money and providing and all that. But I think really my main level of success is kind of how well and how present can I be with my kids and my wife and my family. I think that's my success, barometer right now is those kind of
Yeah,
things.
I love that. I love that.
Everything else is a bonus, right? If I get to
Right.
go run for 3 days in the mountains, fantastic. Um,
Yeah.
but yeah,
Yeah. Exercise is a privilege.
it is. It truly is. I was just doing a 50K, and you're kind of in the dumps last weekend, and I was running with someone, and they made the comment about just consider yourself lucky that you can be out here running, and we had this whole kind of in-depth conversation about 25 miles in about just thankful that we're out there doing it and how most people won't ever be able to do that, and the fact that I can still fit in that training with my work life, provide good care to folks, build good relationships, in the office, and then maintain great relationships at home. That's kind of the win-win for me.
I love that. Well, Matt, thank you again. Again, owner of Forza Therapeutics out in Ohio City, out in Cleveland, just a few miles away from my office. I got to come in and get a little tune up for the knee, Matt.
Yeah, I'm having some peroneal tendon issues, so maybe we'll
Okay.
we'll trade services.
Yeah, for sure. Well, thanks again. This was great. Hopefully, some people learned a little bit. We can do it again, and maybe we'll do a nervous system dive next time. That'll be fun.
There you go. Sounds good.
All right. Thanks, Matt.
Awesome, man. Thanks a lot. Thanks for having
Yep.
me.
Yep. Of course.
Take care.